Well, I'm a standard cardiologist, and I practice in the Texas Medical Center, the world's largest medical center in the world, and I practice general cardiology. I practice some cardiac electrophysiology and also internal medicine within my practice. And from my understanding, my colleagues have respect for me. They have the respect for the work that I do. And they also have respect for the work that I do along the lines of plant-based nutrition. I think part of the reason for this is that over the years of practicing standard cardiology and being part of the club, if you will, I've gained their respect and gained, credibility in that area. And when I moved to the area of plant-based nutrition, they still saw me in the broader scope of what I'm doing. So I think part of it helps, part of the benefit is just being in that community and being part of the quote-unquote good old boys club, if you will, has helped. I think the other part which has helped is that it's the timing. I think we're at a time now that we as healthcare practitioners are realizing that the therapies that we are applying are not very effective. You may go back 50, 100 years ago, the therapies weren't very effective, but there was always the thought process of new technology and the like. And we may not have been as sick as a population maybe 20 years, not even 10 years ago, as we are now. Younger people are getting these chronic illnesses that they didn't get when I was in medical school, over 20 years ago. So these are the things that we're seeing now and my colleagues are seeing. And so part of the timing is that, we're doing all of these procedures, we're prescribing these medications, my patients are still coming back and they're having a problem. And so this stuff that Dr. Montgomery's doing and my colleague Baxter's doing seems to be pretty interesting. And even though I don't know how to do it, I commend you for it. So I think it's a mixed picture. There's some respect for it. In fact, I've given grand rounds at 3 institutions. I've given grand rounds to the thoracic surgeons, cardiothoracic surgeons at University of Texas Health Science Center at the institution I practice with or I'm affiliated with. I've given grand rounds at Texas Women's Hospital. I've given grand rounds at Meharry Medical School. And much to my surprise, the presentation of this data was very well received by my physician colleagues. And in fact, when I gave grand rounds at Texas Women's Hospital, I thought a lot of doctors would dispel it and walk off and that type of thing. They peppered me with questions like you wouldn't imagine. Very similar questions I get from the lay public when I present to them. And not only that, 2 of the physicians were in our restaurant after that presentation, and 2 of them did our nutritional boot camp class. And so that's how well it was received. And similarly with the cardiothoracic surgeons, again, lots of discussion was had within that group, and it created quite a bit of excitement, much to my surprise. So I'm seeing that, and I'm realizing that doctors are more receptive to this now than they probably were, say, 10, 15 years ago, at least in my environment. I see a time where this paradigm shift of healthcare is going to take hold. I see the age where plant-based nutrition is really going to come into its own. We're at a turning point right now, from what I can see, in terms of there being lots of dietary recommendations and the like. But we're at a point in time in our history here in the United States where our healthcare system, which I think the standard healthcare approach or sick care approach that we've taken has never been effective. But the problem is that the ineffectiveness of our healthcare system is now taking its toll, and we can't afford. We can't afford to pay for these many procedures that don't work. We can't afford to pay for these many prescriptions that are not effective, that cause many side effects. And the general public is sick and tired of being sick and tired, if you will. And so it's come to a point where the sheer efficacy of plant-based nutrition is going to come into its own and take hold. I think we're at a point now that we, as leaders in the area, physicians and lay people who are in the area of plant-based nutrition and education, and scientists as well, we need to start to continue to push the message, but also we need to get into the business arena. We need to figure out how to get this issue of plant-based nutrition in the form of healthy foods on every street corner, in the forms of educational programs in every community and in every civic organization. in our communities, the message needs to be pushed further, and it needs to penetrate deeper within our environment. And so this is something that I see that's taking hold, and I think it's going to continue to take hold and going to continue to lead the way and hopefully really save us from the crisis that we're in. I'm on a board of physicians with a company, Boston Scientific, and we talk, and they talk about healthcare disparities, and we're dealing this program, Close the Gap, close the gap of healthcare disparities of Anglo males versus women versus Latinos versus African Americans. And so we talk about, okay, how do we close the gap? And when they look at the data, they say, well, fewer women are getting heart casts, and fewer Hispanics are getting heart casts, a few African Americans are getting bypass surgery or heart casts. And so when you look at that, you say, well, okay, there's a disparity of healthcare, and more of these people are dying from diabetes and high blood pressure and have greater morbidity and the like. And so I think about it. So you know what? Yeah, there are these disparities, but the best way to close this gap is really to look at lifestyle modification. If you change the lifestyle of everybody in the community, then everybody gets healthy. And everybody gets healthy to the same degree. So you may have the Anglo males who are sort of this unhealthy, and then African American males and women are this unhealthy, and women are this unhealthy. But the problem is you get everybody's health up when you feed them all healthy, natural food, and then there are no disparities. Everybody's healthy. So from that concept, it's really critical. But so what I'm saying from the standpoint of plant-based nutrition, people talk about culturally sensitive foods. And there's nothing culturally sensitive about just eating natural plant-based food that's healthy. It's not insensitive, I should say. And so we just need to educate people that the natural food for the human body is plant-based food, as close to its natural state as possible. And anything that deviates from that is unhealthy. And so that's essentially what we need to deal with. And so, yeah, so the race issues, that there is some I think relevance to dealing with racial differences in our population as it becomes as it pertains to health. And in that context, we need to say, look, if everybody ate healthy food, then everybody would be healthy.